Welcome in today. Dr. Durden, I'll be checking out your lungs. So, to start it off with, I'm going to be looking at the chest, looking at body, making sure that there's no lesions or anything, maybe checking out his breathing pattern. Looks alright. I'm going to go and see your fingers. Appears to be no discoloration with the fingers at all. Looks to be alright. The lips look to be alright, don't look to be cracked at all. Alright, so next I'll be taking the patient's blood pressure. Right there. Okay. His pulse was right about 80, and his breaths per minute was about 14. The depth looked all right. There wasn't any shortness of breath that I could see. There wasn't any size throughout the entire process, so looked pretty good. All right. So now I'm doing checking ATP breath. So have you breathe in, breathe out. Should have mentioned this was a really deep breath to go and make sure that the chest was expanding all right. Gonna have you flip around the other side. Now I'll be doing the lateral chest expansion. So I'm gonna be taking tissue slack in, breathe in, breathe out. Okay, once again, that was a big breath, should have mentioned that. Can I have you take a normal breath now? All right, and just everything seemed to be normal. The big breath expanded out really far. The little breath didn't seem to expand out as much. All right, so now can I have you cross your arms and bend your head? And I'm just gonna be going and listening. So I'm just gonna have you breathe normally. Every time I move, just take a deep breath. Alright, everything seemed to be normal there. There is no wheezing, there is no unidentifiable sounds with it. This is nice and consistent. Alright, so I'm going to have you do the same thing again. Cross your arms, bend your head, and I want you to just go and say 99 every time that I move my hand. So
99, 99, 99, 99, 99.
Alright, that was good. There is good vibration felt with that. Next, I will be percussion on the back. Alright, everything seemed to be alright there. I was listening for resonance to dullness over the heart on the left side. You could tell that there was obviously a heart there. It was a little bit more dull in the sounding versus the lungs, which are a little bit more resonant. Alright, can I have you turn around and go towards me? I'm going to go check the front of the lungs. For this one, I'll be using the bell of the ribs. Breath in. Now I'm switching back to the diaphragm. Alright, everything felt normal right there. Alright, so I'm gonna have you flip back around. Sorry for having you do that like that. Alright, so from here, I'm gonna be having you, when I move down, I'm gonna have you say the words 99 when I'm looking at it. Every time I move. Alright.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Alright, this time I want you to say E.
E, 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 E.
Alright, and this time I'm going to have you whisper blue moon. Alright, and that completes those tests. The reason that you would be running these tests is if during your initial examination, during your palpation, you felt something or you heard something unordinary. All of those should be muffled. You shouldn't be able to hear them very well, except around the heart area, because the heart is there. It actually is a little bit more clear. But if there is some place that you hear 99 more clear, that could be a space occupying lesion, such as a tumor. But patient checks out just fine. And that's all we have.
Sweet.